Hi everyone, welcome back to the channel. This video is special for all 6th semester BSc students who are preparing for mental health nursing exam. I know most of you have doubts like what's the new exam pattern, how to write answer properly, what's the format, if it's a disease condition, and what if it's a general topic like communication or nursing role. Don't worry, I'll clear all those doubts one by one and help you understand how to prepare easily and score well in mental health nursing. So, today we are going to discuss mostly about a sixth semester, that too on a particularly MHN. Okay, I hope this video will be very useful and it will clear all your doubts regarding your sixth semester exam. So, don't skip anything, try to follow and understand. If you're having any doubt, please comment down in the comment section and please don't forget to like and subscribe to this channel. I will explain you about exam pattern. Okay. What's the new exam pattern we have for this sixth semester, especially for mental health nursing? So the exam pattern will be 75 marks. Okay, like a new scheme will be for 75 marks. The old paper also will comes for 75 marks. That the paper scheme was different for when compared to old paper. Okay, so they will ask two long questions like essay questions. We need to write two questions. Each will carry 15 mark. Okay, here about the choice I will discuss about that later on. And when it comes to short answers, each they will ask five questions. Each carries 5 mark. So total will be 25 mark. Okay. And very short will be 4. Each carries 2 mark. 4 to 8. And MCQs will be 12 questions. Each carries 1. So 12 marks. So there will be a total of 75 marks. When it comes to choice, for long answers, you will have a choice. Even though you are having short essays like 5 mark questions also you are having choice, but very short and MCQs you don't have choice. You need to attempt all questions. Okay. And when it comes for how to write your answer, no matter what type of question it is, remember these golden rules. Write in points, not in paragraph. Underline key terms. Okay. Write clearly the headings and subheadings. Include nursing management or nursing role whenever possible. Keep your handwriting neat and leave space between answers. Okay. Mostly I observe people writing like if your answers like if your question was completed in one paper, half of the paper one question was completed, and they will continue writing remaining like a next question from the remaining half. No, you never start an answer from the middle. You should always start your answer from the new page. Okay. Next, how to write MHN. Like, what's the format? Like, we have different formats for HN, pharmacology, and we come across so many formats, right? Now we'll discuss what's the format for writing MHN. So, majorly, there are two main answer format you must know. Now, this is a very important in mental health nursing. There are two different formats you must follow depending on what kind of questions they ask. Okay. Format 1 will be disease or disorder based questions used when the question is about mental illness or disorder. So explain the nursing management of patient with the schizophrenia. If they ask like this, any disorder or any disease condition, so this is the format you have to follow. First you need to write introduction, definition, etiology or causes, clinical manifestations, diagnosis or investigations, management. Management will be medical psychotherapy. That means this psychotherapy must and should in mental health. Okay. And after that, nursing management. This is the format. After writing nursing management, you have to write a care plan for 15 mark. If they asked, like here in this question, we have seen explain the nursing management of a patient with schizophrenia. And they might extend this question like write a care plan of for this patient. If they're asking particularly for a care plan in 15 mark, you have to write a care plan. If not also for 15 mark, you definitely need to write one care plan, at least one care plan. If you're having time, you need to write one, two, three. It depends on your time. But for 15 mark, you definitely need to write a care plan. After writing care plan, you have to write a health education and prevention. Lastly, you have to complete with the conclusion. Okay, that's for a disease and disorders. If in the question they're asking for disease or a disorder. So what are the disorders or diseases mainly asked in mental health nursing is schizophrenia, depression, mania, anxiety, phobic disorders, substance abuse, OCD, personal disorders. These are the mainly disorders focused in MHN. Now we'll discuss what's the second like a format for writing MHN. Used when the question is about a principle, process, role, or a theory. Okay. For example, explain the phases of therapeutic nurse patient relationship. This is a question. Now you can't write everything, like you can't write investigations, diagnosis, or like this format you can't follow. So now you need to follow a new format that includes introduction, definition, purpose, or objective or importance. You need to write a purpose or objective, main content. What's the main content in this question? Explain the phases of therapeutic nurse patient relationship. You have to write that content here. After writing content, you have to write a nurse's role after advantages and disadvantages. These advantages and disadvantages or limitations, if necessary, or if the question demands to write, you have to write. It's better to write after objectives, okay? And conclusion. Conclusion will be the ending of for this format. This if they're asking for 15 mark, this will be the format. If they're asking 5 mark also for the same format, okay? In this also, if they are asking for 15 mark, same format. If they're asking for 5 mark, there is no need to write care plan. In 5 mark, if they're asking for care plan, directly write this same format will be applicable for that question also. For example, how to choose the right format. If the question starts with an explain the nursing management of its disease based format, okay? If they're asking a nursing management, if it starts with an explain the nursing management, you need to think that it is a disease based format. If the question starts with describe the principle, explain the phase, discuss the role of the nurse, like this, then you need to follow the format too. What are the important topics in MHN? Nursing management of patient with schizophrenia and other psychotic disorders. Nursing management of a patient with mood disorders. Nursing management of patient with neurotic, stress-related and somatization disorders. Legal issues in mental health nursing. Psychiatric emergencies and crisis intervention. Nursing management of organic brain disorders. These are the main and major important disorder-based chapters you need to follow for MHN, okay? Now, here is a point. Care plan, when and where to write. I already said you, if they ask to write a care plan for any disorder condition, then you have to attempt only for 15 mark. Question is necessary. For 15 mark question, it is necessary. If in case for 5 mark, if they're asking in the question, you have to write the care plan. And this is the format for care plan, okay? Assessment, diagnosis, goal or objective, intervention, implementation. Rational is not necessary, evaluation. Rational is not at all necessary, only these things you need to write. And mostly people ask me how to write a care plan in exam. Okay, let me draw you something. See, this is a booklet. You can write like this, or if this is a booklet, you can turn this booklet and you can write this side also. But if you're writing this way, you can't fill all these things, like you can't assessment, nursing management. You need to congest and you need to write, because the booklet will be half divided into half, right? Here this page will be off and this page will be off. There will be less space. And if you're turning the booklet and if you're writing, the book table will be clear and they don't have any hesitation. They don't, the investigation, like the paper, whoever corrects the paper, they're having time and they are paying to correct your paper. So they don't hesitate to turn your paper to like to horizontal way to correct your care plan. So it's better to write in this format rather writing in a congested way. Okay. How to manage time? Always attempt long questions first because they carry most of the marks. But what I used to say was first try to complete your short answers and very short answers MCQs, then start attempting long answers, or else start attempting long answers and complete within 1 hour 25 minutes to 30 minutes, and the remaining 45 minutes you need to spend for 5 mark, and the remaining 15 minutes you need to spend for MCQs, like short answers and MCQs. Okay, this is the management of time. So we'll conclude this video. So that's the complete mental health nursing exam guide, including the new 75 mark question paper pattern also, and the two answer format you must know for scoring high. In the next video, I will show you how to write a full 15 mark model answer using both the formats, one for a disorder and one for a concept question. Don't forget to like, share, and subscribe, and join my WhatsApp group for free. Like if you're joining in my WhatsApp group, you'll get MHN and CHN notes and the important questions and everything. I hope this video helps you a lot. In next video, I'll give you a complete study plan for sixth semester that includes CHN, MHN, and nursing management. Okay, and there will be another video for CHN, how to write a CHN also. So stay tuned for that video. Thank you so much. All the best for your exam. I hope your next moment will be amazing. Thank you.